so much for joining us today on the Gut Health Dialogues podcast. Today we have Dr. Katie Lee, who is a dentist, speaker, and coach who lives in Colorado. Dr. Lee graduated from the University of Illinois at Chicago in 2010 and was an owner partner in over 80 DSO-supported dental practices throughout the U.S. and served as a clinical partner overseeing 5 states. Currently, she consults for health technology companies and provides implant education for general dentists. Her passion about oral systemic health comes from personal experience and is detailed by her book, Saved by the Mouth. Dr. Lee has won top 40 under 40 dentists in America and International Woman of the Year in Dentistry and is a sought after expert in the media. So, Dr. Lee, welcome to the podcast.
Thank you for having me. It's such an honor.
Can you tell us a little about your personal experience and what sparked your interest in oral systemic health?
Sure. And we kind of said it a little bit in the intro. So when I was 14 years old, I was involved in an ATV accident, which is otherwise known as a four-wheeler accident. I was riding the four-wheeler and didn't have a helmet on. And I crashed face first into a telephone pole and broke every bone in my face from my eyebrows down. I lost a bunch of teeth. And that night in the ER, they did some surgery and decided to wire my jaw shut for about 8 weeks to try and get everything to heal. I also was in a coma for a few days. But as you can imagine, having your jaws wired shut with broken teeth, it was very difficult to keep the teeth clean. And I survived for the next 8 weeks on a horrible diet that consisted of ice cream with Hershey syrup, boxed mashed potatoes, pudding, and Jell-O. So obviously I became malnourished very quickly. My liver enzymes started spiking, my kidneys started shutting down, and everyone, of course, became very concerned about my overall health because I became very malnourished and emaciated. And so I learned from a very early age just how much your mouth affects your overall health. And then when they took the wires off, obviously I needed to get a bunch of dental work done, but I had a complication with my surgery. So even though the wires were taken off, I still was not able to open my mouth. My jaws were locked shut for another 4 years. And so I had many decaying teeth and oral infections, and they couldn't really get in there to treat everything. And so I had lots of systemic issues, lots of inflammation, lots of pain. And then there's the whole social emotional aspect of missing some front teeth. And so I had to go like that for about 4 years until my dentist could finally get in and fix my teeth my senior year of high school when I was finally able to open my mouth. So I learned at a very young age just how important our mouth is to our overall physical health, mental health, emotional health. And so that's how I got into dentistry. And then over time, I just started noticing that my patients were presenting with a multitude of systemic diseases. And I also noticed that they had issues in their mouth too. So if I had a healthy patient systemically, oftentimes their mouth was healthy, and then vice versa. If I had a patient that came in and had several diseases, oftentimes they had a lot of problems in their mouth. So I just kept diving further and further into the science. And that's really how I started my journey.
Wow, that's an incredible story. And it makes sense that you wanted to become a dentist after that. I'm just curious, did that affect other aspects of your health at the time?
So, like I said, I became super malnourished. I have a pretty muscular physique and typically I'm around 130, 140 pounds. And I think my lowest was below 95 pounds, which was very unusual for my body type. And then my liver enzymes spiked, kidneys started shutting down. So definitely affected that because not only was I not getting any nutrition, but I couldn't even open my mouth wide enough to get something nutritious into my mouth to eat. And when you couple that with all of the infection and inflammation I had going on, it was a kind of perfect storm for disaster.
Yeah, I can imagine. So I do talk about this with my clients. I'm a gut health dietitian. I have a lot of people with IBS and SIBO and other issues with their gut microbiome. And I tell them that the mouth is the second largest microbial community in the body, yet we don't hear very much about the oral microbiome. I would imagine, is that even something you learned about in dentistry school?
No. And I graduated in 2010, so I'm not up to date on what schools are teaching now. But just from new docs that are coming out of school and working with me, I still don't think that they're teaching much about the oral microbiome in dental school. We learn about specific bacteria pathogens that cause disease, and we learn about the ones that are really linked to tooth decay, but we never really study it as like this whole community of something that we need to keep in homeostasis. And when it gets into dysbiosis, how it affects the rest of the body. So no, that was definitely not something I learned in dental school. I had to learn all of that afterwards.
I think it's kind of similar in when we look at gut health. I think doctors, for example, stool testing, microbiome testing, they're looking at very maybe specific bacteria that cause very specific infections, but they're not really mapping out a more comprehensive view of the microbiome, and they're not really looking at the body from an integrative and functional perspective. So it sounds like
Yes.
it's the same with this.
It's the
What
same. And we did learn about diseases that will show up in the mouth or signs that the patient has a systemic ailment showing up in the mouth. I always like to say that the mouth is a mirror to what's going on in the body, but they never really connected it as one whole, the body being one whole system that we need to take care of every little part. So same.
Yeah, and I think that's patient experience. That's similar to patient experience too. When people go to the dentist, they don't often have these discussions with their dentist, right?
For sure. And a lot of people, including myself, because given my history, one can imagine I've had every dental procedure under the sun done to me. I've had root canals, I've had implants, I've had extractions, I've had bone grafting, I've had gum procedures, cavities, crowns, all of it, because my history, I started from such a young age of having this bad accident. And so once you get one dental procedure done, that's obviously going to have to be redone or touched up later in life. People are always surprised by that, by the way. We use our mouth more than anything else on our body, yet people think that anything that they have done in their mouth should last a lifetime. Yet our mouth is constantly bathed in acid. About every 20 minutes, our mouth becomes acidic. Every time we eat, there's over 700 million bacteria in our mouth, but yet people have this idea that if you get a filling, it should last a lifetime, which isn't the case. So I keep having all these dental procedures redone. And when I first started down this journey, it was really frustrating because every time I went in, there was a new issue. Yet, other than the dentist throwing filling material at it or fluoride, they would just say, we'll see you in 6 months and we'll see where you're at. And so I have experienced a lot of patients coming in and getting frustrated because in the past, and still currently, we really only treat when something becomes a problem, right? We're not really looking at the microbiome and the community in our mouth to try and keep it balanced so that our own immune system can fight off a lot of these ailments.
So can you tell us more about what role the oral microbiome does have on other areas of health? And for example, in general, and also as it relates to gut health?
Yeah, absolutely. And this might be a long-winded answer, so cut me off anytime you feel like I'm going off on a tangent here. So the mouth basically affects the health of the overall body in two different ways. The first way is inflammation. So it was long thought that a lot of cause of disease was genetic, right? Cancer is genetic. We have genetic family diseases. But what we know after sequencing the genome is that most diseases are, in fact, not caused by genes. Most diseases are caused by inflammation. And this is anywhere in the body. And this is great news, in my opinion, because it means that if we can prevent inflammation, we can prevent most diseases. So the mouth directly affects the inflammatory levels of the body. So that's the first way that the mouth affects disease. The second way is by the specific dangerous bacteria that are in the mouth. They can translocate through the gum tissue and enter our circulatory system and go to distant organ sites and cause damage there because they're not supposed to be there. Specifically in the gut, we know that FN, Fusobacterium nucleatum, is responsible for a significant amount of colon cancers. Over, I think in my book, I put 20%, but that stat has been updated. There was a study that came out the end of last year, beginning of this year. So well over 30% of colon cancers are caused by FN because that bacteria should not be in the distal colon. So if it gets there from the mouth, we know that it can cause polyps and cancer. We know that bacteria directly affect fertility in both men and women. We know oral bacteria affect the health of our heart. They are linked to other types of cancer, such as oral cancer and pancreatic cancer. We know it plays a role in inflammation, Alzheimer's, dementia, you name it, oral bacteria probably play a role in it. one of the first things that we see too, in terms of bacteria affecting distant organs, especially the gut, is going to be chronic bowel issues. So if someone has IBS or Crohn's disease, we're going to see a lot of those symptoms show up in the mouth.
Because everything you're saying, it's similar in the gut microbiome, right? So we have normal bacteria that's supposed to be in the gut, as an example, and I would imagine it's the same in the mouth, right? You're supposed to have commensals there, normal bacteria, and then either if a pathogen is introduced, which is an organism that's not supposed to be there, or if the bacteria just get out of balance where maybe some not so favorable bacteria overgrows, then you end up with problems, right?
That's exactly it. So we all have bad bacteria in our mouth, and they usually don't cause an issue as long as they're being kept at bay or imbalanced by the good bacteria in our mouth. So the whole idea is, instead of in dentistry, which is what we used to do and a lot of people still do, trying to go in and wipe out everything, kill everything in the mouth, we're instead trying to take a more gentle approach where we lower the bad bacteria and then try and supplement or provide a better environment for the good bacteria to be there. So that way the body's own immune system can kind of keep the health of the mouth in check. Because again, every time you eat, your pH in your mouth is going to drop. We're going to have a spike in the bad bacteria. And so this is a much more sustainable way to stay healthy than it is to try and wipe everything out and then go to your dentist every 6 months for, cavities and deep cleanings.
So that's interesting, because I think the concept of that good bacteria are supposed to be there, I think that's pretty well understood in the gut. But you're saying in the mouth too, there's supposed to be good bacteria.
They're supposed to
they protect against the overgrowth of less good bacteria, right?
Absolutely, absolutely. And when we talk about the digestive system, really the digestive system starts with the mouth. But over 100 years ago, dentistry was kind of pulled out of the rest of the body and the medical system and kind of made its own entity. And I tell people all the time, you cannot have a healthy mouth if you don't have a healthy gut, and vice versa. You can't have a healthy gut if you don't have a healthy mouth, because it's all part of the same system. And we are swallowing a liter of saliva a day and 100 billion microbes a day. So we need to be really careful about what we're swallowing and what's seeding that gut bacteria. Most of those microbes are going to be killed in the stomach and the small intestines. But if we're swallowing some gram-negative anaerobes, which are the bad bacteria, they certainly can make it down to the distal colon and cause a lot of issues. And so we'll see when patients have these bacteria present in the mouth, it oftentimes will manifest as bleeding gums, gingivitis, or gum disease. But what happens is we get a breakdown of the gum tissue by an enzyme. That enzyme is called MMP8. That enzyme goes in and starts to cut through the gum tissue. That's how the bacteria from the mouth get into the bloodstream and get into the distal colon. And we know that same enzyme is what is responsible for breaking down the lining of our gut and what causes leaky gut issues. So I don't think it's a coincidence that the same process that is linked to gum disease is linked to leaky gut. It's all connected.
Yeah. So we're a couple different mechanisms where this can happen. So basically, are we talking about LPS, like toxins that are produced by
the bacteria? Yep,
bacteria
exactly.
Get through the gut, basically toxic pieces kind of the cell wall of the bacteria that trigger our immune system to respond with inflammation. You're saying they go through the mucous membrane of the mouth into the bloodstream that way, right?
Yeah, they go through the epithelium of the gum tissue. So exactly what happens, right? We have these gram-negative bacteria. They're secreting substances. Our immune system knows that they are not supposed to be there. So our immune system is going to release white blood cells and other macrophages and other things to try and kill those bad bacteria, or the invaders, if you will. And the immune system also releases the enzyme called MMP8, and then they activate it. So it becomes alpha MMP8 or activated MMP8. And the best way to think about MMP8 is it actually is like a scissor. So it's going to go ahead of the white blood cells or immune cells, and it's going to cut through any collagen in the body to allow the body's immune cells to get to the source of infection or invasion. And so it's that enzyme that's then breaking down the gum tissue, and it's doing it to try and help us to try and get rid of that bacteria. But instead, what it does is it starts to cause gingivitis, gum disease and what we call leaky gums. And that's what allows the bacteria from the mouth to get to the rest of the body. And that's the same enzyme that's taking place in the gut too.
That's so interesting. Yeah, because I think a lot of people have heard about leaky gut. They maybe don't know what it means
Yeah.
exactly. I think maybe they think it's related to their poop and not really, but it actually means that there's the single cell layer that separates the contents of the intestine from the bloodstream is becomes porous. So what you're saying is this enzyme kind of zips it, like maybe kind of tears open or tears
It
apart
cuts through
the
the,
cells.
yep, it
Yeah.
cuts through the cellular junctions, the junctions that are holding the cells together. It goes and cuts through to make it permeable for a reason, but it ends up damaging us in the long run.
And that's how we get issues all over the body, right?
Mhm.
Where it originates one place and it goes, the inflammation travels in the bloodstream into other parts of the body. And then I do want to mention there's another thing that I see quite often, which is low stomach acid. And this can be an issue too, because as you mentioned, we're swallowing a liter or two of saliva every day. And that stomach acid is your body's first line of defense. So I think if you do have unfavorable bacteria or an overgrowth in your mouth, they can in fact populate, say, in your small intestine and even in your large intestine when we're not producing enough acid to kill them off. So I do see this practice and it can make you susceptible, I tell my clients, to things like food poisoning and SIBO. I see it a lot with SIBO. So a couple of things I tell people to kind of watch out for or some clues that clue me in that they might have low stomach acid would be the food sits in their stomach too long, or they see undigested food in the stool, maybe they have bad breath, or maybe they're burping a lot. So I just wanted to mention that's something to watch out for.
That's a really good point. And in America, anytime we have heartburn or acid reflux, we assume it's an issue with too much acid. So then we start taking proton pump inhibitors and all this other stuff that is used for a different reason, but we're only supposed to take those things for a very short period of time, but people are on them for months and months, if not years. And usually the issue is, like you said, too little of acid, not too much, or a sleep issue or something like that. But yeah, I'm really glad you brought up the issue of acid because I think that's really misunderstood in health.
Absolutely. And in fact, unfortunately, I think a lot of people, when they're prescribed those proton pump inhibitors, so we're talking about like omeprazole, pantoprazole, drugs like that, they have no idea. It's kind of like maybe presented as here's a pill to help your stomach, and they have no idea. And so by the time I meet them, maybe they've been on it for years and they just have no idea how many side effects that come from that. Medications do have their place, but again, like you said, for temporary use. But let's get to the root of the issue.
Yeah.
And a lot of times the reason we're not producing enough stomach acid is things like stress or like a miscommunication between the brain and the gut. And stress can kind of block those signals. So that's an example of the type of thing, or maybe it could be a stomach infection that's causing the reflux. So really looking at what's causing that, so we don't just have to take a medicine as a Band-Aid.
Yeah. This is just a question I have for you since you're the expert. What do you think of betaine HCl?
I think in some cases it's helpful. I use it at times. I would say if we have some clues really pointing to low stomach acid, that's an option. It's a bit harder hitting than some of the things I'll start with. So I'll usually start with more lifestyle interventions, like for example, mindful eating, because 20% of digestion actually starts in the brain before the food even gets into your mouth. So like smelling the food, chewing the food 30 to 40 times to mix the saliva in, slowing down, maybe taking 2 minutes to box breathe or do diaphragmatic breathing before you start eating. And that turns off the sympathetic nervous system, which is the fight or flight, which interferes with the brain, telling the gut to produce stomach acid and pancreatic enzymes and for the gallbladder to start releasing bile. Because when we're in fight or flight, which is supposed to be a temporary state, but we're kind of in this state on and off throughout the day chronically. But then our body's directing our nervous system signaling and blood flow away from the internal organs to the extremities so we can move.
Yeah.
But that's not helping us digest our food. So even just taking a couple minutes to slowly breathe will turn off that sympathetic state and activate the parasympathetic, which is the rest and digest mode. So
yeah, I wrote about that in my book, actually, that when back in the day, right, when you're running from a lion so that you weren't going to die, it was not convenient to poop. So our bodies are designed to move everything away from the digestive center when we're in that fight or flight mode. But unfortunately, we're in it all the time now, like you said. And one of the things that I've learned the hard way is I used to not take lunch for over a decade at work, and I would just push through and I would shove something in my mouth as I had 5 minutes. And I had a lot of digestive issues. And it's been the last couple of years that I've done some research on this, especially when trying to write the book, that yes, you have to slow down and stop to eat. You can't eat on the go if you want to be healthy.
Yeah, same here. I have a history of GERD, and I notice if there's a day that I rush and I shovel down lunch, I feel it and I pay
Yeah.
for it. Yeah,
Yeah.
maybe for a day or two after as well.
Yeah.
So it's a huge help because a lot of people have never thought about that. So that's one thing I recommend is the mindful eating, slowing down at mealtime, really focusing at mealtime. Also thinking about smelling your food as your mouth salivates. Also, your digestive system salivates. So that's when your stomach starts producing acid, your pancreas starts releasing enzymes, your gallbladder starts releasing bile. So smelling the food can be very helpful. And then another thing you can try before going to betaine, you could try some digestive bitters that stimulates, like when you taste bitter and it stimulates saliva, again, it stimulates your other digestive secretion.
Yeah.
So that's
And
like an
that's
herbal tincture.
Yeah. And that's so important because our saliva has an enzyme called amylase in it. Amylase is responsible for breaking down those carbohydrates. So we want to start the digestive process in the mouth. And that's why so many people that suffer from dry mouth, which is also called xerostomia, have an exorbitant amount of digestive issues because they can never really get that process started. And then the stomach's doing too much work. And saliva is also super, super important for our oral health, not only our microbiome, but also at preventing cavities because the saliva bathes the teeth in something called the salivary pellicle. And that protects our teeth from the harmful bacteria from starting to form plaque and also from the cavity causing bacteria from causing cavities. So that was just the reason I'm kind of thinking out loud here, because you talking about smelling your food, stimulating saliva kind of brought me back to, oh yeah, I need to remember that too.
So dry mouth is something to think about with this whole conversation too, right? Because a lot of people aren't producing enough saliva. There are conditions like Sjogren's syndrome, which is an autoimmune condition where you're going to have issues with dry mouth. If you notice, for example, you're the last person sitting at the table to finish your food, that might be an indication you don't produce enough saliva. Do you see this as well?
Yeah. And I get really nervous about lack of saliva because those are the patients that are going to have a ton of gingival inflammation, which is bleeding gums, and they're going to have a ton of cavities. So I get really nervous when someone doesn't have enough saliva because those patients are really difficult to manage. Because even if I go in and I restore their cavities, if they don't have any saliva to protect those restorations, they're going to come back in 6 months and have cavities again. So we got to fix the root cause, which is figuring out why they have low saliva. So that could be anything from their kidney function could not be working as appropriately as it should. They could be dehydrated. That happens a lot, especially in Colorado where I live. It could be, like you said, autoimmune. So autoimmune is basically your body attacking itself, and it's creating this chronic exacerbated inflammatory response. So if someone has rheumatoid arthritis or Sjogren's or any of those autoimmune disorders, Crohn's disease even, they're going to be chronically inflamed, and that's going to shut down. That inflammation actually attacks the salivary glands and shuts them down. So you brought up stress. So when we are in fight or flight, the stress will actually turn off our saliva. So I'll see patients who are chronically stressed or who have very high performing careers, they oftentimes will have issues with saliva production. And then another big one, and I'm really curious to hear what you think on this, is airway. If someone has not skeletally developed appropriately over their lifetime, maybe they have a high vaulted palate, maybe they have some sinus issues, deviated septum, and now they can't breathe through their nose and they're breathing through their mouth, that's going to dry out their mouth and cause a whole bunch of issues with dry mouth, gum inflammation, and cavities. And we also know that decreases nitric oxide production. It decreases the pH in the mouth and causes a whole bunch of issues with microbiome. So curious to hear what you think about airway and gut.
Yeah, I definitely agree with that. And what would you say about how sleep plays in with this?
So totally tied in. For me, it's all one and the same. Sleep for me is so important for many reasons. Sleep is important for our stress response. It's important for brain health, for memory, for emotional regulation. And then it's also important for our airway health, because when we sleep, if we can't breathe through our nose, we're going to be chronically ingesting dirty, polluted air. So our nose is designed with the turbinates and the cilia to filter out all of the pollutants, bacteria, fungi, microbes, viruses, all those that are in the air. But when we start breathing through our mouth at night, and that could be through a whole host of issues, and a lot of these become chicken or the egg. It could be allergies, it could be polyps, deviated septum. It could be that when we were growing up, we didn't have proper tongue position, so our palates never flattened out, because the roof of the mouth is the floor of the sinuses. And so we want those sinuses to grow and expand. But if we don't have proper tongue position, our sinuses end up being vaulted in there, and then they decrease in volume. And we know that causes the airway to collapse. So all of this will lead to breathing through our mouth at night. That's going to, like I said, decrease nitric oxide, which is not good for our heart, among other things, dry out the mouth, cause cavities, gum disease, change the microbiome. And we know sleep apnea is very dangerous for our brain health and for our heart health.
Yeah, absolutely. That's so interesting. So all these lifestyle things really make a difference. And what are some signs for that somebody might be able to look at to clue them in that this is an issue for them, that their oral microbiome might be impacting their health?
The microbiome in general, or airway?
The oral microbiome.
Oral microbiome. So the biggest things that I always tell patients, if you see pink in the sink, so when you're brushing or flossing your teeth and you see pink in the sink, get to your dentist right away. That is not okay. I love little catchy phrases because people will remember that. And I heard that long before. That's not something I came up with, by the way. But if you see pink in the sink, get to your dentist. That is not okay. And if it's chronic, what I tell people is, if you have pink on your floss or toothbrush one night, but the next night it's gone, you're probably okay. But if you're seeing it night after night, definitely not okay. So I would get to your dentist and request a microbiome test. Salivary testing is so important. And we know that a lot of patients are fully aware of getting their gut microbiome tested. I feel like it's a thing that we know about in the United States, but yet no one seems to think about testing the microbiome in the mouth, dentists included. This is not very common among dentists. But if we don't know what we're dealing with, we don't know how to treat the bacteria in the mouth unless we know what's there. It's the same thing in medicine. If you go to the doctor with a sore throat, they're going to culture it and see if you have strep, because if you do, you get a specific type of treatment. And the reason why patients continue to go back to their dentist year after year, 6 months after 6 months, and they're not getting any better, is because perhaps we're not rendering the appropriate treatment for what the patient has. So if you see pink in the sink, go to your dentist, request a salivary test, so that way you know what bacteria is present and how to treat that specific bacteria. Because out of the bacteria we test for, the main ones that cause issues, half of them are resistant to cleanings. And so if you have bleeding gums and you keep going back to your dentist and you're still bleeding every time and you're just getting a mechanical cleaning, even a deep cleaning, half of those bacteria, if you have them, aren't going to respond to that. So we need to know if they're there so we can treat them differently. Other things is if you have chronic bad breath, not just like morning breath, right? But like if you're noticing throughout the day, like you just can't get rid of the odor, that's going to be an issue. Some patients will complain about metallic taste. That's something to go in and get looked at. Burning tongue or kind of burning mouth, I would get that checked out as well. And then if you're noticing that your gums are receding over time, And sometimes that you can just notice it by looking in the mirror. Maybe you're starting to see some spaces in between your teeth, or maybe your teeth are getting really sensitive when you're drinking cold water or brushing. That's a sign that you're losing the structure around your teeth and you should get in right away.
And is the oral microbiome test going to be something, or in the salivary testing you're talking about, is that something that people's dentists are going to know what they're talking about? And
fortunately, not everybody. No, it's not. And as we talked about earlier, it's not taught in school. So this is not something that like is required to get a dental license. And so this is all kind of advanced knowledge stuff that we have to pick up along the way. And people aren't doing anything wrong by not doing it. I want to start by saying that because for several years, I didn't do this either in my practice. So you can still be a great clinician and not do this stuff. But now that we have these testing modalities out there, I encourage patients to seek them out because it's definitely a higher level of care than what we were able to give in the past. But no, not everyone will be able to do them. You can search for dentists in your area. You could call the office to see if they do salivary microbiome testing. And then there's also people that will do the test for you kind of remotely because it's just a spit test that you send in. And then you could get your report and take it to your dentist for treatment.
okay, that's great. Yeah, you mentioned the gut microbiome testing, and I think it's similar with gut microbiome testing, that most doctors and standard practitioners won't do gut microbiome testing. They may do a stool test. So I have lots of clients say, "Oh, I've already had a stool test. I've already had that." Well, they're testing for very specific things, maybe C. diff or pancreatic insufficiency. They're looking at just a few markers versus like a comprehensive digestive stool analysis, like what I use in my practice, where we're looking at the whole balance of microbes. I mean, as much as we know is there, we're looking for just many, many, many more markers. And again, the balance, do you have enough of the good? Do you have an overgrowth of something that maybe is not so favorable? Do you have a pathogen? Are you producing enough enzymes? Are you also producing and conjugating bile? Do you have inflammatory markers? Are you producing nutrients that are going to keep your intestinal lining healthy? Do you have evidence of leaky gut? So we're able to look at so much more. Is it the same? Is it similar with the oral microbiome testing?
We're getting there. I think some companies are coming on the market now that aren't just looking at the bad, because you just brought up a really good point. Someone could be devoid of bad bacteria, but do they have enough good bacteria? I think that's really important. Also in the gut, which we haven't really determined this in the mouth yet, but enzymes and other things like that, we haven't really isolated kind of good enzymes. We're still looking at just microbes. But yeah, some other companies are coming on the market that are looking at beneficial bacteria as well and trying to find ways to supplement those beneficial bacteria, because we can't just look at the bad stuff, right? We got to look at the ecosystem as a whole. So we're getting there in oral health. I would say we're not nearly as advanced as the gut health practitioners are.
That's so true what you said about creating an environment, because so one of the things I just kind of alluded to is I'm not going to say that any microbiome test maps out the entire microbiome, because we can only go as far as science knows that information. And truthfully, we have many, many microbes in our gut that we probably aren't even aware of yet. So so a lot of times people will think of, okay, to support my microbiome, I need to take a probiotic or maybe eat probiotic foods. And while that's definitely a helpful piece, and that's a tool I use all the time with people, we're feeding things we know about, but we want to feed more than that. So creating an environment where the healthy microbes can grow, even ones maybe we don't know as much about, to study enough to put into a probiotic capsule is important.
Yeah. And I think it's important too for people to know that they need to retest, because the microbiome, at least the oral microbiome, is very transient. And so our microbiome is totally influenced by our emotional state, our mental state, our stress levels, by what foods we're eating, by the environment around us, the people we surround ourselves with, places that we're at. So like, for instance, I was just in Spain, in Europe, at a conference. When I came back, and this is when I use like the betaine HCl, I can tell my gut microbiome shifts from when I go to Spain and when I come back to the US. I mean, for a few days, I feel off. And it's because it's who we're around, our environment, what we're putting in our mouth, the food, things that we're touching and seeding. And so I think it's important for people to understand to always be testing at regular intervals to see where they stand, because your needs could certainly change very quickly over time. And if you're not staying on top of it, you don't know.
So when someone says, even if they've had the test before, the question is what's going on with you now that you're having these issues?
Totally. And we'll see that with patients. I'll have a patient that comes into the practice. Let's say they've been healthy for the past 3 years. Gums look great. Teeth look great. They come in, all of a sudden they are a hot mess and they're bleeding like a stuck pig, and their gums are messy and they're starting to get bone loss on their teeth. I mean, health in the mouth can change in as little as 90 days. And so I always tell people this: at the moment we start to see a change in your typical health, we need to test and figure out what's going on so we can give you an accurate diagnosis and an accurate treatment plan. And I wrote about this in the book too. I had a family member that came in who was always healthy. And she came in and I was like, whoa, what has happened since I saw you last? This is not how you typically look. And then that's when she had disclosed that she was having a lot of gut issues. And of course, her gastroenterologist told her she was fine. And then it turned out that she had SIBO. And we were able to pick up that something, again, the mouth is a mirror of the body. We were able to see like something is not right here. And we were able to get her diagnosed and treated appropriately.
So interesting. Yeah. And so tell us more about so you do the oral microbiome test, and what are some of the things you can find? And then what are some of the solutions?
Yeah, great question. So a couple of things that I like to look for in my microbiome test is, one, I really like to do an interleukin 6 gene mutation test, because that's going to tell me, and there's several inflammatory markers, gene markers in the body, but the one that I look for is the interleukin 6, because if a person has a genetic mutation in this interleukin 6, I know that their body is going to be predisposed to inflammation. So what this means, and for example, I have this mutation, and I don't think it's a coincidence that everyone on my dad's side of the family, they all have heart disease and diabetes. Those are inflammatory diseases. And so I had a feeling that I had this gene mutation, and I do. And so what this means is that any little invasion or insult to my body, and even stress, right? My body is going to have an exaggerated response to whatever is there that's outside of the norm. Now, this is important for me to know because it gives me the power then to make sure that I am staying on top of my healthcare and my oral health and what I do on a daily basis and my lifestyle factors. I need to be really careful about what I'm putting in my body and how I'm living my life, because I'm gonna be more prone to illness than other people. So I like to do that because it tells me essentially how aggressive to be when treating patients. So for instance, if I came into my practice and I knew that I had this interleukin 6 gene mutation, and let's say I had a couple bleeding spots in my mouth, as a dentist, I would treat myself more aggressively because I know it's going to spin out of control. Then I also want to test for the bad pathogens that I know cause not only gum disease, but also affect systemic disease, such as heart disease, dementia, fertility, arthritis, cancer, things like that. And then I'm going to want to check to make sure that the patient has plenty of good bacteria. Something else that people like to know now is the bacteria that's causing bad breath. We can actually isolate the different types of bacteria that cause bad breath and help them with that. And then the last real main thing that I like to check for is I like to do a 3D X-ray scan for patients, because our jaws and our teeth are three-dimensional images, or three-dimensional things. And so I like to be able to see circumferentially around the anatomy to make sure that there's no hidden infections or abscesses. A lot of times, and this has happened to me, I've had teeth abscess and had zero symptoms whatsoever. And the only way I caught it was on a three-dimensional scan, because a traditional X-ray did not show it. So I like to do that. And that three-dimensional scan will also show me if the patient is predisposed to having an airway issue. So those are the main things that I check for when patients come in.
Okay. And what sort of treatments do you use? So I know in functional nutrition, so I can refer people. So for example, if they have SIBO or say they have a pathogen, to get a prescription for an antibiotic, but we also like to use herbal antimicrobials sometimes for various reasons. What are some of the tools that you use? Do you use antibiotics? Do you use herbals?
Yeah, it kind of depends on the severity of the infection. It depends on the patient's oral hygiene habits. And it depends on kind of their medical history. And so, and the bacterial profile. So like I said earlier, 50% of the harmful bacteria I test for are resistant to cleaning alone. Although you still have to do the cleaning because that's part of the treatment. It just means that you have to do something else to kill those other pathogens. And so depending on, there's some pathogens that are tissue invasive, meaning instead of living in the plaque biofilm on the teeth, they love to get into the gum tissue and burrow in and live there. For the tissue invasive bacteria, we'll use tissue lasers like diode lasers. For other bacteria that are resistant to cleaning, we'll use ozone treatment or antimicrobials to kind of kill those bacteria. And then we always recommend, typically we'll purge the oral microbiome for a couple weeks, meaning we may wipe it out with just a mouth rinse and then try and rebuild it into a healthy microbiome. Or if we know that they're already suffering from heart disease, diabetes, arthritis, gut issues, maybe their bacteria load is off the charts. For those patients, we might do systemic antibiotics to try and get rid of it. For a long time, I was trying really hard not to use systemic antibiotics, but the research says, and from my clinical experience, when you have an infection that bad, and when the patient has other comorbid diseases, it's very difficult to get those infections under control without wiping it out. But what's important is that if you do wipe something out with antibiotics, that you must go back and replace it with what you want to be there, because it's much easier to kill good bacteria than it is bad. So if you give someone a very strong antibiotic, it's going to try and kill both good and bad. But I always say the zombie apocalyptic bad pathogens, a few of them are going to survive, and you don't want those to then be able to take over the whole environment. So you must reseed with what you want to be there afterwards.
So you said that because that's kind of with functional nutrition, we have the 5 R's. The first one's remove, and then we reinforce, we repair, we re-inoculate, and we reintroduce.
Oh, I love that.
So
Yeah.
we have remove, and then later we re-inoculate.
Oh, I love that. That's great.
Yeah. So for people listening that want to take the next step, you have a virtual practice, right? And a physical practice and a book, right?
Kind of. So I have a book called Saved by the Mouth. It's a really cheeky, fun, easy read talking all about oral systemic health. In every chapter, I talk about a patient in my practice that would come in with a systemic issue. We figured out that the mouth was contributing to it and how we treated the mouth and how it affected that systemic ailment. Right now, I have a virtual practice. So what I'm doing is providing salivary testing for patients. I spend a lot of time with fertility patients and with gut health patients. Actually, those are my 2 main client bases that I see. And essentially what I'm doing is I will do a saliva test for the patient. I'll go over the results with them and create a care plan that's personalized for them. And then I'll work with their current dentist to get them the care that they need. Or if they need a provider, I'll help find them one that can render all the different treatments that they need to help with their microbiome. And then I'm in the middle of building my new practice right now. Hopefully it'll be ready in Q1 of 2025.
That's so exciting.
Yes, it's a big project, but I'm really excited. It's fun. It's going to be this holistic. I've got to be careful with my words. When I say holistic, I mean comprehensive, a comprehensive integrated health clinic where we have physicians, practitioners, functional meds, nutritionists, gut specialists, dentists, airway health people, all in one facility so that patients have incredible access to care. So I'm really excited for that.
Amazing. I think that's the vision, right, of where we want healthcare to go.
Yeah, I always found that. I'm sure you find that too. I know you have a really great referral network, but oftentimes what I'd find with my patients is they would come into my practice. I would be talking to them about oral systemic health, and they'd say, well, do you have a cardiologist I can go see? Or I don't even have a primary care doctor. How do I go check my blood sugar? And they would call around and they wouldn't be able to get in for 3 or 4 months. And here I am telling them how urgent their situation is, but the urgency or the access to care wasn't always available on the other end. So I'm hoping this way patients will be able to get the care that they need.
It's a big problem. I know the gastroenterologist, just even that's kind of a first line with my clients, can take months for them to even get in for a first visit. Then they order testing and then see you in a few more months. And it can be, there's a lot of demand for services. And
Yeah.
It's tough. So that's awesome. I can't wait to hear how that turns out. We
Thank
are going
you.
to put your information in the show notes, so your website, your Instagram link, Facebook, all of that. And you have an offer for our audience today, right?
Yeah, there's two offers essentially. So if people go to my website, we'll provide this link. They can download the first chapter of the book for free. I always recommend read the first chapter. If it sounds interesting, great, get the book. If you're like, no, this isn't for me, then at least you haven't wasted your money buying the book. And then the second offer is if people want to do a saliva test with me, especially your patients, I'd love to work with you on this and kind of co-treat patients. But when they book the saliva test with me, if they put in the code, I think we did mouth 24, they can get $50 off the test. And I'll just refund that $50 to them when they put that code in there. And then hopefully we can work together on some of your patients.
Thank you so much for that. I think a lot of my patients will benefit from this because it's something that we talk about, but as we're talking about solutions and actual access to services is kind of limited. So
Yeah.
these are great resources.
Yeah, I'm really excited about this. I had a patient yesterday who's a friend of mine. He had a little, or not a little, he had a lot of head trauma growing up as an athlete. And so he actually went to the Amen Clinic. I don't know if you've heard of the Amen Clinic, but it's a brain health clinic in California, like world renowned clinic, and did a bunch of tests, really bad results, which really scared him. Did a bunch of work, treatments to try and get everything improved and didn't see any results. And when he went back, they said, well, you must have a chronic infection somewhere. And he read my book. I did the saliva test, horrible infection going on in his mouth. And he's currently getting that treated. So stay tuned. I hope to have some better news for his new results, and hopefully he gets some better results. But the mouth definitely affects the health of the body.
That's a great example of somebody obviously willing to put a lot of effort, travel out of state, right, to fix their
Yes.
issues. And
Yeah, that was a $10,000 test and trip just for a diagnosis. That doesn't even include the treatments he was getting. When a couple $100 for a saliva test and treatment, pretty good return on investment for your health.
absolutely. Well, thank you so much for joining us today.
Thank you for having me. This was fun. And I learned a lot too.
Yeah, me too, definitely.